Thank you very much, everyone, for joining us. Okay, I think if you're ready, Miss, we'll start.
Yeah.
Okay, sure. Right. So, hi, everyone. Welcome to the third episode of Health Huddle, where we discuss interesting topics about healthcare, wellness, and genetics every Wednesday at 8 p.m. My name is Irina. I'm a science communication intern at Advanx Health, and I will be your host for today. And we have Ms. Jeng Mun from 𝗪𝗪𝗵𝗔 with us to talk about children with learning difficulties in the time of the COVID-19 pandemic. Ms. Jeng Mun is a clinical psychologist and a lecturer at 𝗪𝗪𝗵𝗪 who has plenty of experience in treating and helping children with learning disabilities and their families. So first, Ms. Jeng Mun, could you please tell us a bit about your profession and your experience with children with learning disabilities?
Thank you, Irina, for the introduction, and welcome to this Health Huddle episode today. So my name is Jeng Mun, and I'm a clinical psychologist. So besides practicing as a clinical psychologist, I am also lecturing in 𝗪𝗪𝗵𝗪. So my experience dealing with learning difficulties has been maybe about 9 years since I graduated. But I would say that the number of learning difficulties children that come to us is not as high as other neurological disorders like ADHD, autism, and in fact later on we will discuss more about that. Besides seeing children with all these neurological disorders, I also do a lot of psychotherapy for adults and children, psychological assessment, as well as recommending some treatment plans for them to improve on their well-being. So this is the practitioner side of my work. On the other side, as I mentioned just now, I also do lecturing work. So I lecture quite a fair bit of abnormal kind of abnormal psychology, we would say, which means some mental health conditions, as well as including specifically on children's psychological health condition. So I hope that with my knowledge and with my experiences, I'm able to share with you the COVID-19 kind of impact on learning problems, specifically on this very unique population, which is the learning disability population.
So right now we'll start with our first question of the day. Firstly, Ms. Jeng Mun, could you please define for us what exactly a learning disability is or what makes it up?
All right, so we need to think this neuropsychological disorder in a very umbrella term, whereby in this umbrella term, there are actually so many different types of challenges that the children would face. For example, one of them would be definitely learning disability. The second one would be the very common one, which is autism. In short, we call them ASD because it's autism spectrum disorder. And then we also have ADHD, and in long term, it's attention deficit hyperactivity disorder. And sometimes there are also conditions whereby there's no hyperactivity, so it's ADD, attention deficit disorder. So there are also a few more conditions, which maybe we shouldn't go that far, but because these are the three very common disorders that typically people seek help. So just now your question was what really is learning disability, right? Learning disability, we need to think like they have a different processor, meaning that their brain has a different processor. For us, maybe a majority of us uses maybe we use the Windows, okay? The processor is a Windows. But for learning disability, maybe their processor is something like a Mac. So the way they process things is very, very different from us. And because of that, when we actually use the Microsoft kind of way to teach them, they cannot comprehend it properly. And therefore, they cannot understand them. To them, you need to have a special way, which is the Mac way. We need to find a way to approach them in order for them to understand. So in short, right, learning disability is something like their brain is wired differently compared to majority of us. It doesn't mean that they are people start to use the word like they are stupid, they are lazy. It doesn't mean like that. It's just a different manner of processing things. So this is what learning disability is. So can I go a little bit more to explain, or?
Actually, we have a question from the audience asking, how can we identify whether a child has a learning disability or not? So,
okay. So maybe that will help me to also continue with what I want to go deeper.
Yeah.
So learning disability, generally, there are 4 types, yeah. The first one is normally people call, very common, they call it dyslexia. Dyslexia is when they have difficulty with reading and writing. Then we have dyscalculia, very fancy names. So it's about difficulty with mathematics and numbers. And then we have dysgraphia, which is inability to, comprehend or maybe produce some drawings. It's about graphics, okay? And the last one is non-verbal learning disability. So that is less common. So with these 4 different types of learning disabilities, right, in order for us to confirm whether the person has this condition, the person need to go through a certain number of years of education first. We need to rule out the condition whereby they are not, because they are not exposed to anything. That's why they have learning problem. So if the person has already learned a number of years, typically nowadays children go to kindergarten maybe at a 2-year-old or 3-year-old. So with the number of years, like maybe 3 to 6 years old, and they come for assessment at 6 years old, we know that they have already exposed to education for at least about 3 years. And that time, when we do the assessment and yet they cannot reach the level that they're supposed to reach, the academic level that they're supposed to reach, then possibly there is actually learning problem. So how do we do that? We need to use assessments, psychological assessments, and normally we will use academic assessments to test where do they stand? Do they have difficulty in certain areas like I mentioned just now? Is it regarding reading? Is it regarding mathematics? Is it regarding graphics or something else? So after the assessment, we will make the diagnosis from there. So the whole process goes like interviewing the parents, interviewing the child, and then doing assessments. And the assessments can be very thorough. And then after that, only we can make the diagnosis. Yep.
Okay, great. Yeah, I think that answers the question from the audience. Moving on from that, we're going to start talking more about how they are affected by MCO. So what are some of the pressures that you think children with learning disabilities may face, especially with online learning and and this is in terms of their psychosocial wellness?
Yeah, I think this is a very good question because, not even children with learning difficulties, even for working adults doing this online thing is so struggling in the beginning. Of course, at times go by, it's been a year now, we somehow gotten used to it. But I recall myself when it first started, I also struggled a lot. So when I think from the perspective of children with learning difficulty, they must be struggling a lot too. So in terms of this struggle, they may also experience something like maybe some isolation because they cannot get what the teacher is teaching through this screen. And maybe they also find it shy to ask questions, and then they result in a lot of isolation. And because of the changes of many routines, daily routines, and maybe there's also lack of support for them, all these factors can come together and result in poor emotional well-being, reduced emotional well-being. And all this, we also need to look at the external factor, which is what's outside of them, which is maybe the parental support. Is there anything like that? Or maybe there's people telling them that, are you lazy? You don't want to go online? There's so many societal expectation on these people too. So I would think that it's definitely a lot of pressure, a lot of struggle that they are going through, and that may potentially affect their psychological well-being.
And leading on from what you talked about in terms of parental support, So a lot of parents are actually in denial that their children have these learning disabilities. So obviously you've seen that in families that you treat, but have you seen that particularly more so during MCO and during CMCO?
During MCO, CMCO, are they in denial? I think to answer your questions, maybe I need to recall how many cases have I seen during MCO that they are in denial. Because of MCO, our cases have been reduced because they need to come face to face to do the assessment, and because of that, they just want to wait. But I'm thinking, in terms of denial, of course, there are certain percentage of parents would have this kind of denial. If we look into the government indication of where do these individuals, these children with learning disabilities stand, is under the orang kurang upaya. It's under the disabled individual. So I would assume that it must be very disheartening for the parent to put the child with this label. So the grieving over the loss of this capability will definitely be there, and therefore the denial will definitely be there in some certain parents. So however, we need to encourage and we need to share information and resources indicating that actually people with learning disability is not the end of the world, or like what we actually place them under the category of being disabled. There are a lot of success stories out there, and in fact the founder of Facebook is also having learning disability. So with that, we want to give them hope and we want to shed light in them, but definitely there are certain interventions that need to be done to help them to be successful. So yeah, I guess like you mentioned just now, are parents in denial during MCO? I haven't encountered anyone like that.
So going back to about the cases you've seen during MCO, and how you've actually seen like a reduced number of cases of people that you need to help. How do you feel that? Do you feel that that could potentially be quite detrimental to the children whose parents are waiting for MCO to finish first before making, before testing their kids to see whether they have the learning conditions or not? Do you think that could be detrimental to the kids?
Yeah, I guess yes, maybe, because it also depends on the age of the child. When the child is actually at a schooling age where they're supposed to thrive in their academics, and they're still struggling because of the learning problem, and the parents are still waiting and never give appropriate intervention, then probably it's too sad to see this condition. But because learning disability is not something that is life-threatening, so a lot of parents would think that COVID is much more scary compared to learning disability. That's why they didn't want to bring for now. So I guess this is like a dilemma of, like, for example, being a mom, maybe like, should I send my child to school now or should I keep at home? That kind of thing. It's open anyway. So I think parents are in a dilemma, and I truly empathize with that. So I guess people just need to make a balance from there.
Okay, we have some questions from the comment section actually. Someone would like to know whether learning difficulties can actually start from adulthood onwards, or is it just purely diagnosed from your childhood?
I think this is a very good question, because we do receive a lot of inquiries from adults asking us whether that's possible or not. So usually neuropsychological disorder is only for children, which is below the age of 18. So any age below 18. And for learning disability, it should somehow be diagnosed from age 6 or 7 onwards to 18, because they need to have a certain amount of years to be exposed to education. So the question was asking, is it possible that they suddenly have learning disability, is it?
Yeah, like during adulthood, suddenly you're diagnosed with
that is not possible. The only possibility is that when they were younger, it was not pointed out. They didn't realize it. And then as they grow older and older, they somehow come across this condition called learning disability, and then they finally get the diagnosis even after 18 years old. So it means that the condition has been there since young, but nobody tell them anything about it. They also don't know what's going on. And then only adulthood they found out about this.
And just another quick question is that what are the early signs or the red flags of learning difficulties in children?
Okay, the red flags of children having learning difficulties can be a lot, okay? The very typical one that I would say is the confusion with B and the D. I think this is like everybody also know about this, the confusion of B and D, confusion with left and right, I and J, and then upside down, the words upside down, that kind of thing. But we have to be cautious, to do not over-diagnose or do not over-jump to the conclusion that when a child having the confusion with B and D, then the person will have learning disability. Sometimes some young children like age 5 or even 6, they still have this a little bit of confusion and they self-correct. They can self-correct. So that doesn't mean that they have learning disability. They are still learning how to recognize things. So the very good red flag is that I would look into overall their academic achievement. So people who have learning disability, their IQ is normal, is at least normal or even smarter than the average individuals. But it's just that when they go into learning a specific thing like reading or writing or mathematics or drawing, then their performance is impacted. It's just one specific area. So sometimes it's difficult to pick up, I would agree. But as parents, maybe we need to closely monitor our child's academic performance, and then we will see from there whether we are able to pick up some red flags or not.
Thank you for that. So going back to the whole COVID-19 pandemic, there's actually been recent news in the UK about people disputing their healthcare system, the NHS, for not including people with learning disabilities and autism and ADHD in groups with priority access to the vaccine. So do you agree that people in this group should be prioritized given the relatively prevalent rate of children currently diagnosed?
My only agreement to them is that if they are given the vaccine, would it mean that they are able to go to school as usual? So if that is the case, then I would agree that vaccine should be given to them. But I also read some article regarding this issue, saying that learning disability has more likelihood of dying from COVID. Which I don't know how true is that. I haven't done any research on this, but I feel like is there a connection? Because learning disability is more towards learning problem, but COVID is more towards the respiratory issue, right? So I don't know how connected it is. Maybe they have done research, but my perspective is that if they are given vaccines, and they can go for schooling, proper schooling, because they have done the vaccine, then I would go for that. But if it's something else, then I'm not sure how can I answer to this, because it's none related to the psychological perspective. Yeah.
Okay, great. And likewise, do you think their carers should be prioritized as well? Simply because
so the virus is spreading very fast if it's close contact. So if the person with learning disability gets vaccine, maybe carers should also get, so that all of them can be safe to go to school.
And then moving on to our next question, do you think that children with learning disabilities are better off or worse off in MCO or in the lockdown? And are there any cases that come to mind specifically?
I think during this MCO, as I mentioned, it doesn't only impact on these individuals, it also impacted on a lot of different people. So I guess they are still struggling, and I can see a lot of reports from parents saying that it's difficult to teach them. I don't know how to teach them, and when they don't understand certain things, I don't know how to teach them. So that is the struggle that parents as well as children is facing. They wanted to learn, but yet they cannot get the right support. And when it comes to online, they cannot get the accurate support compared to face-to-face. So I think they are struggling a lot, and a lot of adaptation needs to be there. So I think maybe we need to think about some maybe online techniques to help them, specifically this cohort, this population. So that would be very helpful for them. Yeah.
There's another question that I have actually is, since the rest of the student population in Malaysia currently has to be doing classes online, if they're under SPM level, do you feel that children with learning disabilities should be taught in similar classroom settings than neurotypical children? Simply because there are some parents that do believe that their kids shouldn't be ostracized from normal society, so to speak.
Yeah, I think this is something regarding inclusion education, and it's something that in our country, in Malaysia, we are starting to learn about this importance of inclusion education, whereby we include every child into a classroom. Every child has the right to get education, and research has indicated that if you do inclusion education, their learning will increase, they get more stimulation, and in long run, research even indicated that in long run, they even pursue maybe university or tertiary education and so on. So that is actually a positive thing for us to have, and therefore we want them to be included. But that would mean that a lot of perspective and mind-changing kind of people that we need to have, saying that they are no different. We need to include them all together in one classroom. Yeah.
That's interesting because I'd actually like to know more what you think would be the future of educating children with learning disabilities, particularly in the public education sector. From what I know, a lot of children with learning disabilities have to go to like reading therapy or private kind of therapy or education just to get them in the same group or like in the same academic form or standard as like other children who don't have those learning disabilities. So what do you think exactly is the future of public education for children with learning disabilities?
So maybe my hope for the education in Malaysia is that definitely inclusion education, whereby they are fully integrated into the school, be it public, private, or international. All of them should be in the class together, learning together. But that would mean that we need to have a lot of change in mindset, a lot of training for the teachers, a lot of preparation before this could happen. Otherwise, it will be another problem. They are not ready for it. So first, we need to train the teachers. We need to train the school. Secondly, we include people who are maybe at least at the maybe moderate to mild level. Then we see whether we can integrate much more severe cases into the classroom. So the key idea is that no disruption, of course, definitely to maybe any students who are in the same class. And basically, there's no stigmatization given to these people labeled as, learning disability. All of them can learn, is just in a different pathway. They take pathway A, another student take pathway B, and there's no right or wrong in this manner. Yeah.
Are there any particular cases during MCO or during CMCO that you'd like to share with us? Come to mind.
Cases, yeah. So I can share a case that is a 6-year-old child just got diagnosed with learning disability. So the child has difficulty identifying the B and the D. And then also the I and the J, very typical. And then when we did the assessment, we realized that the reading part was very her style, I would say. It's her style of reading. For example, when I asked her to spell apple, then she would spell it as A-P-L-E or A-P-A-L, I forgot. Technically, it seemed to be correct, A-P-A-P-L-E or something like that. But for the correct spelling is not correct. So a lot of words are similar to that, whereby she used her way of spelling to spell out something. But when you teach her how to spell it correctly, maybe the first 2 times she get it, but then after that she didn't get it again. She forgets it again, or I don't know whether she forget or she just cannot process the thing. So I would see her condition as like maybe when we show A-P-P-L-E, these 5 letters, right, as something that is very easy and we just take it for granted. It's so easy for us to spell it. But for her, when I show these words to her, it's like a mess. It's like, you know, a symbol that is so complex. It's like another language, maybe some very foreign language which we haven't seen it before. So she finds it so difficult to comprehend. And that we concluded that she has learning problem. And when we actually saw the case, we also looked at the medical history. She actually has a few rounds of epilepsy before when she was younger. So the doctor has already, when she was younger, the doctor has already told the parents that possibly this condition may impact on her learning problem. So we somehow found the condition to have to be true from what the doctor reported. So unfortunately, this has happened. But we have referred her to an association called the National Association of Learning Disability to get appropriate support. So I guess those who would like to know where they can get support, or they would like to know where to get maybe assessments or like therapy or so on, they can actually go to this National Association of Learning Disability in Malaysia.
Yeah, that actually answers quite a few questions that are coming out in the comments. But specifically for accessible help over MCO, maybe for parents who are struggling with financial difficulties, struggling with having online resources, are there any specific resources or support they can use to get help over the MCO for their child?
Actually, I went through this I don't have close contact with anyone in this association, but I went through the website, and in fact, they have a hotline for you to call up.
Oh, okay.
So probably we can call up. Otherwise, then you just need to seek help from any educational psychologist, validated educational psychologist in Malaysia, and any clinical psychologist in Malaysia. All of them should be trained in making a diagnosis and assessment and giving you a proper advice on what to do.
Quickly, just asking you one question from the comments. Is it true that children with learning difficulties are actually smarter in some ways?
Usually children with learning difficulty, their issue is that they are only impacted in terms of one area of their academic performance. Association, but in terms of IQ is not related to academic. So now we are going to talk about the types of intelligence. There are 2 types of intelligence. One is the novel intelligence, whereby you can problem solve things without even being taught on certain ways to solve it. So that is what we call intelligence. So IQ can be average or even smarter than people who doesn't have learning difficulties. So not all learning difficulties individuals have a higher IQ. They can be average or slightly smarter, slightly higher IQ, but not all.
So the last of my questions. So most parents of children with learning disabilities don't have the professional training to teach their kids at home, which is needed with the online learning for MCO. Apart from particular academic techniques, what are some things that they can do or some things that they can avoid to not be detrimental to their children's mental health?
Okay, I think we need to go step by step, whereby the parents themselves have to be accepting this child, that, okay, I'm here to guide my child. I'm not here to, hoping that my child is going to be someone so bright, or, some in a night something can change, that kind of thing. The parents have to be ready. And then we also need to understand that the child needs time, need to take time. So basically, we need to be patient in clarifying things and find out what is the best way for the child to learn. For example, the case that I shared just now, the way she spelled apple is very unique to her style. So then we tell her that maybe you can imagine apple as like a graphic, and how can you use this 𝗵𝗶𝗶𝗹𝗶 to draw a picture out of this letter. And then she write 𝗵𝗶𝗶𝗹𝗶, and then she draw a picture of an apple with the wording, and then she remember the entire image like that. And that's how she remember apple. So every individual has their own way of learning things, and you just need to find the right way. So maybe parents need to really be patient in finding the right way to guide the child. And of course, one-to-one guidance is very helpful compared to like maybe a class, because as I mentioned many times, one-to-one guidance would give you the understanding that how the child can actually learn things in their unique way. So a very cliche or very basic thing is that don't stress up. Parents, don't stress up. If you feel that you are stressed out with what you are doing with your child, take a break for yourself, relax before moving to face your child again. Don't give up. Your child will definitely be able to learn. It just takes a little bit more time. And also take your time to learn how your child learns. You will be surprised to learn new things from your child too. So I guess this is a very high fulfillment or very high satisfaction kind of project that you are in. And you just need to be patient.
I think that's actually really good advice. Thank you very much for that. Just one last question from the audience. A parent would like to know whether you can actually overcome learning disability permanently, and how can the parents actually help in making that as close to reality as possible?
So learning disability is a neuropsychological disorder. It means that there is an issue with their brain wiring, as I mentioned. So it means that this condition will not be taken away. The condition will stay with the person until the person gets older and older and older. So it wouldn't be taken away, like the condition wouldn't be fully treated, cannot be cured. So the second question was?
Are there any specific things, so apart from the mental health of the carer and of the child, is there anything academically that the parents could help to, like, for example, with the parents who are like waiting before they help diagnose their child later on, are waiting of it? Are there things that they can kind of help or do to curb the learning disability in the meantime while waiting for support later on?
Okay. Actually, I do hope that I can give you some very fancy things, fancy techniques to do, but the reality is that it's just repetition of things over and over again. And in psychology, we call it cognitive rehabilitation, whereby we rehab the person in certain areas that they are not good in. For example, if I have difficulty identifying B and D, I am going to do this repetitively until I identify it correctly. Of course, we can do it in a fun way. We can use like whiteboards, we can use dances, we can use drawing, but it's just repetition. There's no magic that we can do, unfortunately. I hope that I can share, but no. So this is what we actually do: cognitive rehabilitation, repetitive training until the child identifies it in a correct way.
Okay. So that's the end of all my questions, actually. So I'd like to thank everyone for joining us. We currently have 25 people watching this session, so thank you very much. This is the end of today's discussion for Health Huddle. I think we just have a few more questions left from the audience. They'd like to know whether learning difficulties are actually genetically inherited.
We have done a lot of research to identify all neurological conditions, whether it's genetic or not. In psychology, we call it nature versus nurture, whereby there could be possible 50% of inheritance, and it also can be 50% non-inheritance. So if we want to identify specifically why the person has this condition, we are not able to identify, unfortunately. So the person will just be born with it, and then one day when the person goes to school and repetitively after a few years, this person still cannot learn, then we diagnose the person with learning disability.
And another question that's being asked is if it's possible for someone to have both autism and a learning disability. How are the two interconnected?
Actually, it's rare, but maybe it's possible. People with autism, they also have issues with learning some languages, because people with autism, what affected them is the social interaction. They have these repetitive behaviors as well as delay in their languages. So maybe that part of delay in languages is similar to learning some languages, learning some reading, problem with reading and writing, which is related to languages. So we want to see whether they are mutually exclusive or they are overlapping. If it's overlapping, we'll only give one diagnosis.
If there are any other questions, any final questions from the audience before we end tonight's session, now is the time to put them in the comments. To wrap up, basically, today I had clinical psychologist and lecturer Ms. Jeng Mun from 𝗪𝗪𝗁 University to join us on Health Huddle and discuss how exactly children with learning disabilities have been affected by the MCO. Ms. Jeng Mun was kind enough to present her thoughts to us and also share some of her anecdotes and experiences in her professional practice. Just double checking for the comments. Okay. That's how exactly children. I think we've addressed all the questions actually. Thank you everyone for joining us, and this is the end of today's section. Do like this video and share it with your friends as well, please. Thank you so much, Ms. Jeng Mun.
Thank you.
Thank you.
There's quite a number of people actually experiencing allergic reaction soon after receiving the first dose of the COVID-19 vaccine. But again,